Good. So today we are going to talk about fibromyalgia, and it is common to my clinic condition, but apparently it's not as common. So we are going to start from here. And this is slow. So we are going to talk about what is fibromyalgia, how we diagnose it, and what are the treatments, possibly what is right now available and what are the future treatments. So fibromyalgia is a disorder characterized by a pain, and it's widespread, musculoskeletal, frequently accompanied by fatigue, sleep, memory issues. They call it fibro fog, and researchers believe that there is amplified painful sensation by affecting the way your brain and spinal cord process the painful stimuli. Frequently, symptoms start after some kind of event like a physical trauma or surgery, infection, or significant stress. And then it will continue for a long, long time. So apparently it affects between 2 and 4% of population. So in the big picture, it's not as many people have it, but in reality, a lot more people, it's probably underdiagnosed. That's why it shows up only between 2 and 4% of population. But a lot more people who actually experience that and just think that they are achy or tired, and they probably go without diagnosis for years and years. Women are more likely to get the fibromyalgia, but men still do get that too. And many people with fibromyalgia will have tension headaches, TMJ, irritable bowel syndrome, anxiety, depression, and actually, if you remember, we were talking about interstitial cystitis. One version of interstitial cystitis will be associated with that too. So this kind of picture of how it may feel. So people can have those chronic headaches, sleep disorder, dizziness, fibro fog, anxiety, depression, vision problems, weight gain, feeling cold, feeling hot, multiple chemical sensitivities. Definitely, I've seen that. Muscle pain, fatigue, twitches, morning stiffness in joints, problem with urination. That's probably more related to that interstitial cystitis. Nausea, GI issues frequently, and pain with urination or pain with period, dysmenorrhea. So the diagnosis is made based on how many symptoms in each category you have and how severe they are, mild, moderate, or severe. And based on so many points, you will have a diagnosis. And we pretty much discussed the symptoms. So in the past, the diagnosis was based on 18 pain points of fibromyalgia. And there you can see they're in front of body, on the back of the body, but located around the neck, shoulder area, base of skull, that's at the back, in the elbows, around the knees, around hips, and buttocks. So those painful points. In the past, if you had 11 of them, then you have a diagnosis of fibromyalgia. But then American College of Rheumatology removed this criteria, but just having tender points is enough, in addition to fatigue and brain fog and so on. So it was interesting for me to learn more about why do people have pain, and therefore I was looking into different research articles. And at some point, people thought that the nerves have their own blood flow, and that blood flow possibly interferes with perception of pain. And that's possibly one of the pathways how it can happen. there are things that you can see here. Treatment frequently is not effective, and it's includes narcotic pain medications, antidepressants, anti-seizure, and we'll talk a lot more about that too. Another interesting study was done with functional MRI, and it compared 370 fibromyalgia patients versus 135 control patients. And the areas in the brain showed up different activities. So it definitely appears to be that patients with fibromyalgia have different response to pain based in central nervous system. And pretty much this study from 2018 examined PET scan in 31 fibromyalgia patients versus 27 healthy patients. And they did find more glial activation, which technically inflammation in areas of the brain. And that's what probably is crucial part of development of fibromyalgia. So there's, for years, I've been using this low dose naltrexone, and I wanted to put it here because one of things this low dose naltrexone is used for is fibromyalgia. So actual naltrexone at high doses was originally found in 1963, and the typical dose between 50 and actually 150 milligram, not just 100. And at those typical doses, it blocks activity of narcotics. And it's naltrexone is relative of naloxone, and naloxone right now is used to revive people with overdoses of narcotics because that's how it works, blocks it. On the other hand, small doses of naltrexone, usually at about 4.5 milligram, have quite different properties. And those properties include anti-pain, analgesia, and anti-inflammation. So there was first trial with low-dose naltrexone in humans was presented in 2007. And as time went on, different conditions were studied. But for fibromyalgia, it appears to be that there is this activation of glial cell, which is inflammation, and low dose being neuroprotective. It was definitely a good idea to try to use it. And it appears to be that low dose naltrexone reduces production of reactive oxygen species and other potentially neuroexcitatory and neurotoxic chemicals. And that's one of the ways how it works. There is another chemical which is relative of LDN. It's called dextronaltrexone. It apparently works very similar, but it doesn't appear to be dependent on opioid receptors. So it doesn't block, for example, action of morphine on your body. And the importance about that LDN usually we would not want to use in people after surgeries on actual narcotic medications because it potentially can interact with or interfere with the action of narcotic medications. But dextronaltrexone is not going to do that. So you could use them in conjunction and have potentially beneficial effect from both. The medication is actually very inexpensive and usually well tolerated. So there are possibilities how it works. I will not go into much details. And here's the actual study where participants, 29 people with fibromyalgia, who a lot of them showed improvement. So you can see that no change was in about 20% of people. 10% reported minimally worse, and about 70% of people have improvement. about 13% very much improved, 37% much improved, and 20% minimal improved. But still, it was about 70% who had some kind of improvement. When we look at low-dose naltrexone at other conditions, Crohn's disease is another one where it works, and it showed 80% of study participants exhibited significant improvement. So you can see that it has some kind of anti-inflammatory action, not only in the brain, but in the guts, and could be very promising. However, we don't have high, we don't have large placebo-controlled studies that at this point considered to be gold standards. But more importantly, we don't have FDA approval for use of low-dose naltrexone for anything. It's considered to be experimental, despite whatever number of studies that were conducted. And naltrexone is generic, so I bet at this point nobody is going to be super interested in conducting those studies, unless somebody will decide to use it a different name and a different formulation and say that this is something new and different. So who knows? So the typical dose published is about 4.5 milligram. We used it usually at 1 milligram and build up dose up to 4 milligrams. Other way I use this is 0.5 milligram, and you increase it every week by 0.5 up to 4.5. But some people do not even require higher doses. They may not feel better, and they may feel worse. In that case, I always suggest people to reduce the dose and take a smaller amount and stay on that. So side effects, in terms of side effects, fair amount of people reported vivid dreams, and here it's cited as 37%. I probably see much less of that, and even some of the patients may have nightmares. If you switch the timing of LDN, usually we give it at bedtime for a morning, then obviously that night dream, vivid dreams are no longer a problem. And that's what occasionally we have to do. Another possible side effect is headaches, but it's not as common. So, but it may happen. So the future development for fibromyalgia treatment, so to have that actual dextranaltrexone available. Right now, it's not available anywhere in the United States, and it's considered to be, again, quite experimental. There are some other studies with minocycline and dextromethorphans, which are antibiotic and anti-cough, I believe, that potentially have some glial cell modulating properties and may potentially be used, but more studies are required. Stinging nettle, reishi mushrooms, curcumin, other options that possess many key characteristics, but again, no large studies yet identified, but potentially a good thing to add if you have fibromyalgia. We talked at some point about medical marijuana and whole endocannabinoid system, and there is in Ohio, for example, fibromyalgia is on a list of indications for medical marijuana, and the reason for that because it has neuromodulatory effects. It improves to reduce neuroinflammation, plus other version of inflammation, plus potentially cognition, improve cognition, memory, reduce nausea, reduce pain, and reduce vomiting. Paradoxically, some patients on medical marijuana or whatever other marijuana may develop cycling vomiting as a side effect. So it's very individual, has to be checked. So anandamide is naturally occurring cannabinoid in our body, and patients with fibromyalgia frequently have higher level of that in their system. And that indicates that probably they have some issues in endocannabinoid signaling. And that brings to the point of trying to use it for fibromyalgia. This big scheme here is how possibly cannabinoids can work on the brain. And I'm not going to go into depth, but you can see it's quite complex action. Different version of cannabinoids like delta-9 THC showed in some studies to reduce symptoms of fibromyalgia. Quality of life has improved in people who consume cannabis compared to fibromyalgia people who did not consume cannabis. And there was some improvement, significant improvement in symptoms. Synthetic cannabinoid called Nabilon showed a superiority over placebo to reduce fibromyalgia symptoms, plus in anxiety and some other categories, improving sleep and so on. But it did have a lot more side effects, including dizziness, drowsiness, dry mouth, and vertigo in quite a lot of patients there. In general, medical therapy for fibromyalgia is limited. There are only 3 medications that actually approved for fibromyalgia. 2 of them are SRI and SNRI, which is duloxetine and milnacipran, and there is one anticonvulsant, which is pregabalin. And pregabalin is Lyric, if anybody remembers that. On the other hand, there is some effect of pentoxifylline. Pentoxifylline is used for people with peripheral artery disease. It's supposed to improve blood flow, blood circulation, but somehow it actually reduces the symptoms in some category of fibromyalgia patients. With gabapentinoid, that's actual gabapentin is older preparation, and pregabalin is more like active form of gabapentin, and it's approved as Lyrica. Frequently, Lyrica is considered to be a controlled substance, and gabapentin controlled in some states and not controlled in other states. And apparently it's been prescribed off-label for fibromyalgia patients because it's much cheaper than Lyrica, which is pregabalin, and could be fairly effective. The SSRIs and SNRIs, I mentioned that the effectiveness here, 52% of people on duloxetine and milnacipran had clinically relevant benefit over placebo, compared to 29 in placebo group. So again, if you think it's obviously not comparing apples to apples, if you remember the effect of low-dose naltrexone, there was 70% of people who had some kind of improvement. Here it's only 52%. Again, cannot compare exactly because we don't know how these studies were conducted. Was it similar? If they were conducted exactly the same way and exactly same things were compared, then you could say that, yeah, maybe LDN is even more effective than duloxetine and milnacipran. So interestingly enough, pain relief and reduction of fatigue was not clinically relevant for duloxetine and milnacipran, and in 50% of patients or greater, and did not improve the quality of life at all. So I would say those agents are approved, but not as effective as you would want to. Studies, there were some studies about acupuncture, and not only acupuncture, but electroacupuncture. There was some improvement. Electrical stimulation, where you can put stimulation on scalp, and like transcranial magnetic and electrical stimulation apparently does help significantly more than sham application. Then thermal therapy, you can use heat or cold, and heat is frequently called spa therapy, and is very popular in different European countries, as well as Japan and Israel. So in the United States, in general, different spa applications are much less common. But in Europe, people starting from 1800 and 1700, like Russian aristocracy would go to Europe for different waters. They called them waters, but it was technically medical spas where you could have different balneotherapy, they call it. You could be having wraps with different versions of dirt. You will have different waters with minerals. And that was very popular back then and still is. And here they had like 10-day treatment was done on 48 fibromyalgia patients, and they saw improvement of quality of life. And they used like Dead Sea salts, and that was effective and safe. Mud bath treatments, again, was very, very popular. And here it appears to be effective, and people were stable after 16 weeks of in comparison to baseline. Cryotherapy is cold therapy, where you actually wrapped into cold something, or maybe icy cold, get submerged into icy cold water, and so on. It apparently can improve anti-inflammatory cytokine, endorphins, ACTH, which cause cortisol spike, white blood cells, and so on and so forth. And it may be a useful therapy for fibromyalgia. Even though majority of fibromyalgia patients do not like cold, like winter months are the worst, but specifically cryotherapy could be better, could have some potential benefit. Laser therapy and phototherapy. Laser therapy, as I'm learning more about that, has a lot of applications. And here the combination of laser administration of amitriptyline, which is one of antidepressants, was found to be quite effective in quality of life and symptoms. And other studies showed effect on pain and other areas. Exercise is very advisable for patients with fibromyalgia, but the question becomes which particular exercise. And apparently there is not enough evidence to say which particular exercise is better, aerobic or stretching or strengthening. But we know that fibromyalgia patients definitely benefit from different versions of exercises because it helps to decrease fatigue and improve pain. Here, a few other studies quoted that strength and flexibility exercises in aerobics exercise rehab led to improvement of shoulder and hip range of motion, hand grip strength, different pains were affected by different exercise. So pretty much stay active. That will help you feel better. Dancing was studied in a study here, and specifically belly dancing, and it was found to be effective in improving of functional capacity, pain, quality of life, and body image in women with fibromyalgia. Zumba dancing helped with pain. Tai Chi, I was doing Tai Chi for several years, and I still do some of the Qigong exercises. And Tai Chi Qigong definitely shown to improve different conditions, including Parkinson's. And here for fibromyalgia, it improved symptoms and longer duration showed great improvement. So definitely, is it just because Tai Chi is stretching and strengthening, or is it because it's body-mind connection? It's probably both, because effect or addressing mental status of the patient is very important with fibromyalgia. Probiotics. People with fibromyalgia have different set of biotics or microbiome in their guts compared to healthy individuals, and therefore it's not unexpected to find studies showing different effect of probiotics on patients with fibromyalgia. And here it says double-blind placebo-controlled study improved impulsive choice and decision-making, but did not affect cognition, quality of life, self-reported pain, anxiety, and depression. So still probably need to find the right version of probiotic to affect the actual pain control, but who knows, there is probably something is there. Then different plants that were quoted here in this very good study or very good article that I took a lot of this from St. John's wort. You probably have heard of that. It's antidepressants, technically herbal SSRI. Here it's found some effect. Quercetin, you've heard me talking about quercetin multiple times. It changes synaptic morphology and some different things. And those studies looks like maybe done in mice still, not in humans. But different ways to affect the pain using herbal medications or supplements.
Isn't quercetin also good for the heart?
It's not probably as much as heart. It's more for immune system. For example, one of protocols for COVID included quercetin. Quercetin is very good antihistamine. It's as well appears to be anti-aging. Especially if you combine
we
with
like
other things.
That.
Yep, we definitely like that.
Yeah, we like that.
And so tips, this is I found on one of the websites, tips of dealing with fibromyalgia. Distress, stress definitely can trigger my fibromyalgia symptoms. Jot it down. So if you have fibro fog and it hurts your memory and focus, keep pen and paper handy. So make a list, and that should help you. Exercise regularly. Use soaking, and frequently people use different things like magnesium. Magnesium helps to relax muscle, and therefore it helps to reduce that muscle tension, reduce pain, helps you to move easily. Instead of caffeinated coffee or drinks, try to do decaf, because it potentially can help you with stress reduction and other things. So definitely take me time every day. Make sure you have that time for reflection and stress reduction and so on. Make work life better. If work leaving you exhausted and pain, maybe try to find different job, try to design a flexible hours that works for both you and your boss. Talk about it. Definitely talk to your partners, talk to your co-workers about that. Communication is very crucial. Just say no. Saying no, it's hard to say for many people, and fibromyalgia is frequently invisible. People may look completely well, but in reality, they could be in pain. They could have this fibro fog, mental brain fog, and they just you may not be able to do everything what's asked from you. So saying no is very important. Make your bedroom a sleep sanctuary. That's self-explanatory, because for fibromyalgia patients, sleep is super important. Keeping daily journal is very useful, because that way you can see maybe what triggers you, and plus it helps you to distress. And join support group. Support group, again, people tend to have different tips and tricks, and sharing that helps other people, and then you don't feel like you are the only person who has it. This is it for right now. Let me stop sharing and let me stop recording.